This is the Fertility Friday podcast, episode number 101. Welcome to the 101st episode of the Fertility Friday podcast. Thank you for joining me today. I'm Lisa from fertilityfriday.com, and this is your source for information about the fertility awareness method and all things fertility. I started this podcast because I believe that every woman has the right to know exactly how her body and her fertility works. I'm here to connect you with the tools and information that you need to improve your menstrual cycle health and fertility, and I feel so privileged to be able to share my passion for body literacy and fertility awareness with you every single week. As you know from listening to the podcast, fertility awareness is so much more than just birth control or trying to get pregnant, because it truly gives you a window into your own health and fertility. And I love sharing my expertise with my clients and helping them to understand their charts and connect with their cycles in our work together. If you have recently discovered fertility awareness, but you're not feeling confident about using it for birth control just yet, or if you've been charting for a while and you're having trouble making sense of what's happening in your cycle, I can help. Get started today with a free 15-minute consultation with me by heading over to fertilityfriday.com/coaching, or just click the Work With Me button on my website. And I would also like to invite you to sign up for the Fertility Friday newsletter. So head over to fertilityfriday.com/ebook, and as a gift to you, you'll receive a free copy of my new ebook, where I reveal what to expect when coming off of hormonal contraceptives, and I share 5 steps to restoring healthy menstrual cycles post-pill. Before we dive into today's interview, I'd like to take a moment to thank my sponsor. Today's episode is sponsored by Circle & Bloom. One of the topics that I focused on quite a bit on the show is PCOS, or polycystic ovary syndrome. I've interviewed a number of guests on this topic and explored the different ways that PCOS symptoms can manifest themselves in a woman's menstrual cycle charts, as well as the different ways it can show up health-wise. In episode 93, I interviewed Joanne Verkuylen, who's the CEO and founder of Circle & Bloom. And in that episode, we talk about the science-backed benefits of visualization, not only for stress reduction, but also the role that it can play in mind-body medicine. Circle & Bloom has developed 2 different programs specifically for women who are struggling with PCOS symptoms. If you're trying to conceive and struggling with PCOS symptoms, the PCOS for Fertility program has been designed specifically to support you on your journey. But the great thing about these programs is that if you're struggling with PCOS, but you're not actually actively trying to conceive, you can still work towards improving your cycles with the PCOS for Health program. So there's 2 different programs to address PCOS, one specifically for women who are trying to get pregnant and one for women who are just concerned about improving their health overall. Each program contains around 20 different visualizations that not only take you through the different phases of your menstrual cycle, but they also target the specific challenges that women with PCOS face. Things like excessive androgens, which would be characterized by facial hair in places that you don't want facial hair, insulin sensitivity, weight gain, as well as delayed or irregular ovulation. And as a special gift to Fertility Friday podcast listeners, Circle & Bloom has offered a 20% discount when you purchase one of their programs. So head over to circlebloom.com/fertilityfriday. So that's circlebloom.com/fertilityfriday. Circle Bloom is one word. And make sure to use the discount code Fertility Friday, which is one word, at checkout to redeem your 20% discount. Now, let's jump into today's interview. And today, I'm very excited to welcome my guest, Jessica Drummond, to the show. Jessica is the founder and CEO of the Integrative Women's Health Institute and is passionate about caring for and empowering women who struggle with women's issues and pelvic health conditions. She's equally passionate about educating and supporting clinicians in confidently and safely using integrative tools to transform women's pelvic health care. And in today's show, we'll be talking about pelvic health, what causes pelvic pain and inflammation, and how to address these issues from a functional medicine perspective. This is something that we haven't yet touched on the show specifically, and so I'm really excited to get Jessica's take on everything. So without further ado, welcome to the show, Jessica.
Hi, thanks so much for having me.
Well, thank you for being here. I'm really excited to have you. I've been an avid follower of your work, so I've kind of been quietly looking at what you've been doing in the area of pelvic health, pelvic pain, pelvic inflammatory disease, all these things. So I'm really excited to get the chance to talk to you. And before we get into it, I would love to find out what inspired you to focus on that particular field. So maybe you could tell the listeners a little bit about your background and then how you found yourself in the work that you do.
Yeah, so I started my career in 1999. I graduated as a physical therapist, and I, like many physical therapists, worked in orthopedics and sports medicine first. But really quickly, within about the first 2 years of my practice, I became interested in women's health. I had patients who had post-op complications from breast cancer surgery that I was working on, with shoulder issues. I had a number of pregnant patients who had back pain, and the physicians, had nothing to offer them because they couldn't give them any medicines because they were on, they were pregnant, or, there were no surgical options while they were pregnant. We actually even had some pretty complicated pregnancy related issues due to like car accidents and pelvic fractures in pregnancy. And you can imagine how scary that would be for the patients. So I sort of went down that path. And in women's health physical therapy, you begin to then work in kind of gynecologic way. The most complex patients that I then began to work with over the next 12 years or so were women who had not just orthopedic related back pain, although that, can be very important, very difficult and quality of life threatening as well, but pelvic pain, so pain related to endometriosis, pain related to interstitial cystitis, vulvodynia, painful sex, was talked about so much less, because don't forget, this was 16, 17 years ago when I started working in this area. And there was very little research. There was very little understanding of what could be done. There were some surgical options, but they weren't great. It was like hysterectomy or birth control pills, and those often didn't work. And that was really even worse, because then you would have had a hysterectomy in your maybe early 30s and you still had the pain. The surgical options are much better now and much more targeted. But really, what I realized is that, pelvic floor physical therapy, those of us who were doing it that then and continue to do that, and now, fortunately, there's a lot more access to pelvic floor physical therapists, although they are still relatively rare. But I would say you could probably find one in every U.S. state. They're in more of the Western countries and even more of the developing countries. But, at the time, there were very few. And so I found that those women really had been suffering. They had been seeing 15 different doctors before they had a reasonable diagnosis. And in some cases, the resolution of their symptoms wasn't that difficult. It was a matter of kind of understanding their pelvic anatomy, their pelvic floor anatomy, understanding that there are muscles that surround the vaginal opening, understanding that there are soft tissues, involved with birth that sometimes get really tight and tense or injured. And I think later we started to realize that there was a lot of emotional component, histories of trauma and sexual abuse, or even other kinds of abuse, trauma, fear. Things are kind of held in the pelvis the way a lot of people hold tension in their neck and shoulders, and they walk around with headaches, So once women were able to just understand their pelvic anatomy, learn to relax the muscles of the pelvic floor, learn to strengthen the muscles of the pelvic floor, and kind of take ownership of their pelvis, there was a potential to really resolve those issues from the root cause without having to have really, complex interventions. And then I would say the reason that I brought nutrition into the fold is that I had my own physical issues. I had a hormonal imbalance that occurred after the birth of my first daughter. And I realized that the kind of nutrition and lifestyle medicine factors that I use to restore my hormone balance certainly would play a role in women with low estrogen or estrogen dominance, or, ovarian cysts, fibroids. And these were some of my most complicated pelvic floor, physical therapy patients that wouldn't get better just with the myofascial soft tissue structural approach.
Mm-hmm. Well, one of the things I wanted to ask you is to kind of paint a picture of what pelvic pain looks like and how it impacts women's lives. You touched on a really important point, which is that the women that you saw often couldn't really find the support that they needed. And in some cases, you said that it was not necessarily a super invasive, difficult strategy to actually alleviate them of their pain. Mm-hmm. So, I'm sure some of the women listening have suffered from this. So maybe you could paint a picture and just help us understand what the impact of pelvic pain is on women.
Well, it's a huge quality of life issue because, well, first of all, in some cases, sex is always painful or painful most of the time or painful irregularly. So it's hard to know like what caused the problem. What did I do this time kind of thing? Or was it positioning? So that's really frustrating. So when your sex life is impacted, your relationships are impacted, feelings of femininity, so that's a huge quality of life issue. And then in other cases, it's not just pain with sex. There can be pain all the time. So pain with sitting, pain with the menstrual cycle. Endometriosis is one of those things that's often not diagnosed, but can show up in teenage girls, with their first couple of periods. So women have painful menstrual cycles that can take them out of work, can take them out of regular activities. And, as I said, they're misdiagnosed or undiagnosed for a really long time. And then if it's more of a bladder issue, and these things often overlap. So if you think about the pelvis as a bowl holding the reproductive organs, the bladder, the soft tissues and muscles and joints, and also the colon and the vaginal canal and the muscles surrounding the vaginal and rectal openings, you could have a combination of like IBS, painful bladder, endometriosis, vulvodynia. Usually people don't have all of them, but they often do have 2 or 3. And so if bladder is a problem, it's going to impact your everyday life because you can have pain with urination, frequency of the urination. And if the bowel is an issue, there's incontinence, fecal incontinence, diarrhea, constipation, IBS, bloating. So all of these things, these organs sort of neurologically speak to each other. We call it organ crosstalk. And you can have pain on a regular basis dealing with your day-to-day bowel, bladder, sexual function, and even just sitting, lying down. And so it's a huge quality of life issue for women who struggle with these issues.
Mm-hmm, absolutely. And what are some of the factors that cause pelvic pain, I guess, in general, or even more specific? I know you've alluded to endometriosis, but what in your practice, what have you found is the reason why women struggle with some of these things?
Well, it really depends on the case, but there are kind of a number of systems we want to look at and make sure that those systems are working optimally. So, coming from my physical therapy background, we look structurally, are the bones and joints of the pelvis aligned? Were there any nerve injuries? The pudendal nerve innervates the soft tissues and some of the muscles of the pelvic floor. That can be injured, anything from cycling to a car accident to a birth injury. And the muscles of the pelvic floor can be tight, they can be weak, they can be in spasm, there can be tearing from, again, birth issues, birth injuries, or, rapes, or just painful sexual experiences. So that's kind of the structural system that we take a look at. Then you want to take a look at the digestive system. As I said, if you've got diarrhea or constipation or bloating, that can make the problem worse. So is the digestive function optimal? Is the woman really digesting her food, or is there a lot of inflammation? Does she have a lot of sensitivities to food? We just published a case study in the Integrative Medicine Journal where we found that a woman with vulvodynia and overlapping IBS, her key issue was about 3 specific food sensitivities. She was sensitive to soy, dairy, and gluten. And removing those essentially resolved the whole situation. Now, we were also looking at everything in her health. So, we're making sure she has adequate vitamin D and no chronic inflammation. If there's systemic chronic inflammation, in some people that shows up as, headaches or joint pain, and other people that shows up as pelvic pain. So there's the structural system, there's the digestive system, there's the hormone system, as we talked about. So too much estrogen, not enough progesterone often is an issue when it comes to endometriosis because that's an overgrowth situation. Low estrogen can lead to vaginal dryness or can overlay with vulvodynia, vulvar pain. Also, estrogen dominance can be a precursor to things like ovarian cysts or PCOS or fibroids. PCOS often also has elevated testosterone, high levels of insulin, glucose imbalances. So like too much blood sugar. It's sort of like I think of PCOS as like early stage metabolic syndrome or type 2 diabetes. So you've got to get the blood sugar in balance. So all of the different hormones that talk to each other, we want them to be humming along. And the other hormone that often we forget about as women is cortisol, which is a stress hormone. And in women who are struggling with infertility, we really want to take a look at cortisol levels, thyroid levels, because estrogen just doesn't kind of work in a vacuum, right? All of these hormones speak to each other. So structural system, digestive system, hormonal system, bladder, how is the bladder lining irritated? So that's again where I would start to look for things like oxidative stress or inflammation. And then there's the psychosocial component. Are you someone who carries your stress in your pelvis? Are you someone who has a history of trauma? Or do you just need, it's not always a huge traumatic issue. Sometimes women, and I was talking about this the other day when we were teaching about vulvodynia, women take on a lot. It's sort of gone from we have the ability to do it all to the mandate to do it all,
The expectation, self-imposed or otherwise.
Absolutely. And so women a lot of times carry their stress, their feelings of needing, their obligation to be stellar at work, to be a rock star mom, to like come home and have makeup on, the whole 9 yards. And we carry that stress in our physical bodies. And so until that lifestyle component is addressed, for some women, this is kind of their Achilles heel. But it's usually both. Like I very rarely find that there's just one of those things out of balance with people and they just change one little thing and it's all fixed. Usually this is more of a condition like, chronic headaches or high blood pressure, joint pain. It's more a lot of vague things that I think that this kind of condition is a useful warning light for us to take a look at how are we taking care of our health on the whole.
Well, what I love about your approach, and then even as you're describing what could cause it, you really get a sense of how integral a woman's pelvic health then is to her overall health. And just like you said, it can kind of be a signal to check into different areas. And so what I love about your approach as well is it really illustrates that it's not just like, okay, she's got pelvic pain, so I'm just going to do this because that's what it always is. It's kind of the starting point that guides this investigation to figure out what the underlying cause is. And one of the questions that I thought of as you were just talking about the different reasons that could contribute to pelvic pain is I'm curious about your approach, because from what you're talking about then, some women would experience pelvic pain as a result of kind of a very specific physical issue. So whether that's physical damage from birth or trauma of some kind. And then there's a completely different reason, which could be related to gut health or inflammation or other bodily functions. And so in terms of when you're approaching a client who has pelvic pain, does your approach for treatment change depending on whether it's more of a physical, structural type of cause versus if it's more of a inflammatory or other kind of somatic symptom cause?
Well, I would say that a lot of times both are at play, but so my background is physical therapy, but currently I practice as a functional nutritionist and coach. So I don't have my hands on patients anymore, at least right now. That may change once I have a little time to get back in the clinic. But in the last, like say 3 years, I've pretty much only worked with patients virtually. So my approach is to look at the piece of the puzzle that is more biochemical, the digestive, hormonal. However, I don't do that in isolation. Most of my patients have teams. So if there's any symptoms where I suspect endometriosis, I feel like it's essential that women with endometriosis, especially if they're younger and want to preserve their fertility, have a thorough assessment from a really skilled excision surgeon. So a surgeon who specifically knows how to diagnose and with laparoscopy. Unfortunately, we don't have a really easy diagnostic marker for endometriosis. The only way to diagnose endometriosis effectively is with a laparoscopic surgery. And then there are very skilled excision surgeons in the United States. There aren't a lot of them, but they're sort of scattered around. So you can find someone, at least in your region. And I've forgotten the name of their professional organization. I think it's AG. I don't know. I'll see if I can find that and send it to you. But, there are several that I know personally. And then there's a website of the surgeons that I would recommend that, if you're looking for someone. But getting a diagnosis of endometriosis or not is important from a medical standpoint, because you can actually use the more kind of integrative approach and dramatically reduce the pain by doing things like removing gluten or using certain herbal medicines or balancing estrogen and progesterone levels, reducing cortisol or normalizing cortisol levels. But if there's still underlying endometriosis, even if you're not having endometriosis related pain, you could impact your long-term fertility. So depending on your age and your plans for having children, you want to understand your options before you just ignore the endometriosis in a sense and, treat it with a more integrative approach. Then you can make that decision. So having a diagnosis is essential for endometriosis. For the other things, my systematic approach would be that most people in my practice should also be seeing a hands-on pelvic floor specialist physical therapist for at least an assessment, because we want to see, is there a structural component? Because women really need to just get comfortable with their pelvic floor muscles, with their, genital anatomy, with feeling movement in their abdomen and movement in their hips. And, there's kind of this black box of, don't look at that. We don't have like a good name for it. Girls aren't supposed to know the word vagina or vulva. It's like boys, I think the statistic is like 92% of boys by the age of 3 know they have a penis, but girls, there's no word for it. There's like, it's down there. It's like, and so there's a lot of shame around just really kind of owning and living in your pelvis. So a skilled physical therapy assessment is really appropriate in all cases of pelvic pain. And then my approach is to walk through the systems. Without good digestive function, even if we, use supplements or nutrition therapy to balance hormones, well, it's not going to be very effective because you can be eating the cleanest diet in the world, but if your digestive function isn't working very well, you're not going to be absorbing those nutrients, so you can't build hormones. So we start with the gut, then work with the hormone system, and also general inflammation, because pain, whether the experience of pain is decided by the nervous system. So if there's underlying inflammation, chronic infections, I wouldn't even call these infections, but like dysbiosis. So things like yeast infections or bacterial vaginosis. So imbalances of the bacteria of the gut or the vagina, then the nervous system is going to be more sensitive than if we clear those out. The nervous system will also be more sensitive if there's underlying chronic stress. The digestive system could be irritated. Cortisol, which is the stress hormone, contributes to problems in the small intestine, which again, then you can't absorb your nutrients, then you can't build hormones, then you can't heal your nervous system. So those 3 systems, 4 systems really, the digestive system, the endocrine system, the nervous system, and the immune system. Essentially, the way I approach that is let's get all 4 of those systems working on all cylinders. Not only will that help with pelvic pain and fertility, but also, again, as we talked about a few minutes ago, your overall health, your cardiovascular health, you'll lose the brain fog, you won't be so fatigued all the time, general other chronic joint pain, things like that. So really just not thinking about, okay, how can we just quiet the pain, but how can we get all 4 of those systems humming along with, in a sense, the side effect being that the pain resolves.
Mm-hmm. Really getting at the root. So obviously that's where functional nutrition aspect comes in, because you're really looking at what is actually going on and causing these things to happen in the first place and acknowledging those as symptoms of the larger problem. One of the things that you said really struck me when you just alluded to how we're so disconnected with that part of our bodies and how so many of us grew up even without having the proper language for it. And it just made me think of some of the work that I do with clients. And part of what I do in the fertility awareness education realm is educate about the basic body parts, showing a diagram of a vulva and making sure that we know exactly what all the parts are, because every boy knows where his pee comes out of, but do women? Exactly. And so just to kind of deepen into that a little bit, I wanted to ask you a little bit more about what a pelvic floor physiotherapist does. I also wanted to ask you about pelvic floor muscles and strengthening them. There's a lot of talk about, doing Kegels. So we're all supposed to do our Kegels. But now there's information suggesting that Kegels aren't necessarily the best way to strengthen the pelvic floor muscles. So I'd love to kind of hear more about those things.
Yeah, those are great questions. So a pelvic floor exam by a skilled physiotherapist is a couple of things. First of all, we keep the pelvis in the body, right? So we're not gynecologists where you sort of just expose your vulva and we'll kind of move everything out of the way and look at the cervix. Now that has its place, clearly, but a physical therapist is going to look at how are the muscles of the pelvic floor. So if you think about the pelvis as being a bowl, the floor is the muscles that connect between the pubic bone in front. So if you can kind of find the hard bone right below the pubic mound, and then the tailbone and back. So it's kind of like a hammock of muscles that also extends out laterally to the sides to the sitting bones and the hips and, some of those bones. So it's like a big giant bottom of the bone of the pelvic bowl. That's the pelvic floor. And it's made up of quite a few muscles. Some are really tiny and superficial. Others are larger. They're nothing, none of them are as large as like the glute muscles, but you've got pubococcygeus, the obturator internus, which is inside the piriformis is somewhat related there. And then you've got these smaller, thinner muscles that are more superficial right at the vaginal opening. And there are others, there are sphincters, but that's kind of the gist of it. So first, what a pelvic floor physical therapist might do is notice, when you stand, how's your pelvic alignment? Do you have any foot problems or knee problems or hip problems or neck or shoulder problems? Do you have strange breathing patterns? Because how you breathe, how is your core strength, your lower abdominal strength, your deep abdominal strength? How is your spine strength? Do you have any pain in your back? Did you have a C-section or an abdominal surgery? Are there any other scars that may be in place? So looking at the pelvis within the body is kind of the first step. Then the second step is really a pelvic exam. So they'll take a look at the muscles right around the vaginal opening. They'll take a look at the soft tissues. Or is there any redness in the vulva, any skin issues, or signs of ischemia where it's not getting good blood flow? Are the muscles so tight that there's kind of a whiteness, lack of lubrication, things like that. So they'll look at the tissues from that perspective and notice when they touch the tissue. So if you think of the vaginal opening as a clock, the face of a clock, they kind of touch the muscles all around the vaginal opening, looking for tightness, tenderness, pain. And it's not always just the muscles. It can be soft tissues. It can be just the vaginal opening itself. And we also look for things like prolapse. So is the bladder in the right position, or is it starting to droop down? Is the rectum starting to droop down? Is the cervix starting to droop down? And that would be an example of a lack of support of those pelvic floor muscles, and maybe overstretching of some of the fascia that holds all these structures up. And there are ligaments that hold things up. So it's really a physical assessment in the same way that a physical therapist would look at the muscles and the joints and the tendons and ligaments in your shoulder or your neck or your spine. Now, when it comes to things like Kegel exercises, and also a physical therapist will also use a mirror a lot of times and show a woman her anatomy. So it's like, okay, here's where you have the scar from your episiotomy, and And also, I think it's helpful to know, you were saying, a lot of women don't know what's normal. They don't know where the urethra is. They don't know where their clitoris is. They don't know that the clitoris is just really deep. It's not just that one small area external. So knowing that there's a lot of variety in the vulvar anatomy, some women have small vulvar lips, some women have large ones, some vary from side to side. There's variations in color. A lot of that is very normal. And just really understanding, what's normal for that woman so that she can notice for any changes. Now, if the pelvic floor muscles are weak, basically we do kind of a strength test of them. So the physical therapist will have her gloved fingers inside the vaginal opening and ask the woman to squeeze and lift up and in. So it's like, can she tighten her vaginal opening and lift? Sometimes women think they're doing Kegels, but they're actually kind of bearing down and pushing out, which can contribute to prolapsed organs, the kind of drooping bladder and rectum and cervix. So we don't want that. So we check to make sure that the muscle coordination is there. Now, Kegel, isn't it interesting? I was watching a comedian the other day. There's all these parts of the women's anatomy that are actually named after male doctors, right?
You saw my instant reaction to that.
Right. You're like, oh, and it's really kind of irritating. But Kegel was this doctor who kind of figured out that, I guess if you squeeze these muscles of the pelvic floor, you can tighten and strengthen them, which is great, except it's very nonspecific. So if a woman has pelvic pain, if she's just sort of generally squeezing and tightening the muscles of the pelvic floor all the time, that could be a bad thing. Because if you can imagine, again, if we kind of use the headache analogy, if you hold your tension in your neck and upper shoulders and you walk around all day with like 30-pound weights in your arms and you just do like 2-inch, neck squeezes because you haven't relaxed your shoulders down for years, that's just going to hurt more, right?
Yeah.
So it's kind of the same thing with the pelvic floor. That's why things like vaginal weights are not always like the best plan. They may have their place in certain situations, but when you have pelvic floor weakness, you're more likely to have things like prolapse and incontinence. And you can have both tightness and weakness. Because again, like let's say you were walking around with your elbow bent, at like a 50 degree or like a 120 degree angle all the time. And then you added 30 pounds and did like small bicep curls. You would be weak if you opened your arm all the way up and then tried to curl up, right? Because you haven't used like 3/4 of the range. Mm-hmm. So if you're walking around with that muscle really tense and then you load it with exercise and without ever relaxing it fully down to its kind of normal resting position and maybe even stretching those muscles, then you're not going to get appropriate pelvic floor strengthening. So pelvic floor muscle exercises that are done well include a component of complete relaxation, possibly even sort of stretching of those muscles, because those muscles naturally can stretch really well. I mean, we fit babies' heads through there, right? And shoulders and the whole thing. And so stretching, strengthening, there should be no pain in those muscles. There shouldn't be kind of knots and spasms and things like that, which can be worked with some manual therapy. And then connecting the nervous system to the muscles. So sometimes it's not even an issue of weakness. It's an issue of lack of coordination. If you're in CrossFit and you're lifting, 150-pound deadlifts and you're leaking urine, well, maybe your pelvic floor muscles aren't just weak, but they may be weak compared to that load, or they may be uncoordinated in that you're not tensing those muscles prior to the lift. So it's not really as simple as Kegels or no Kegels. That's why pelvic floor physical therapy services are so valuable, because you've got to stick the pelvis into the body. What are the activities she wants to do? Is she 80 years old and just wants to be able to stand up from a chair without leaking? Or is she a marathon runner and wants to be not leaking, on mile 23 or whatever? And so we have to consider the woman. And we also consider what is the strength and flexibility of all of the surrounding muscles, the lower abdominals, the hips, the glutes, the low back, and all of that. So at the bottom line is most women with pelvic pain need to start with relaxation kinds of exercises prior to doing any strengthening, or it's just going to worsen their pain. So just doing uneducated Kegels is a bad idea for women with pelvic pain, but they may have pelvic floor weakness. And so having that skilled assessment will help put those pelvic floor muscles into muscle exercises into context and have her do them correctly and with good coordination.
Well, and there's something I'm really curious then for you to speak to kind of along these lines. So, when a woman gets pregnant and has a baby, there's this crazy societal push that drives me up the wall for her to look like she hadn't had a baby within 8 weeks after giving birth. Yes. And so that's the physical, obviously getting rid of the baby weight, quote unquote, or the tummy little pooch. Mm-hmm. Full disclaimer, I have a baby bump and I am not pregnant, and I'm good with it. Just for FYI to all the listeners, because I think that it's time that as women, we try to challenge those ideas that we're supposed to look like we didn't have babies, because I did have two, and I'm very happy that I did. So I wouldn't want to look like I didn't have babies at all. But I'm getting to the question, which is, there's a fear then around this like pre-pregnancy body when it comes to vaginal tightness. And there's this whole idea that, especially if you have a vaginal birth, that, your vagina is then loses all of its elasticity and those types of things. And I think that is one of the reasons kind of for that push for Kegels, because of this idea that we have to work to get our vagina back to how it was before, or we maybe won't be able to satisfy our male partners if we're partnered to men.
Oh, yes, that's a great question. And I think, well, there's a few issues there. As a 42-year-old mom of two, my belly is not the same as it was when I was 28 and I didn't have children.
Imagine that.
But I would say that you can restore healthfully the integrity of the pelvic floor and the abdominal muscles. So, my second baby, I gained 50 pounds. And I know you can't see me here, but I currently weigh about 100. I'm a small woman. So I was on bed rest for 3 months and I was just massive. But it was great because the baby was healthy. We all got through that. And so the soft tissues are by definition of the abdomen going to be quite overstretched, which was a very different experience from when I was 29 and had my first daughter and gained 25 pounds and worked the whole time. So it was much easier to quote unquote, get my belly back, get my body back the first time. However, I 100% agree with you that there's no such thing as getting the body back, because it has by definition been transformed in a very positive way, generally speaking. And so what we want to do is make sure that going into our, in the UK, they call this the third age, our perimenopausal years, that we go into the second half of our life with integrity in our core and pelvic floor, so that we reduce the risk for things like prolapse and incontinence and back pain and hip pain and all this other stuff. And we do want to remain strong and physically fit, or regain and maintain strength and physical fitness, because, again, this is contributing to our global overall health. So we want women to be strength training. We want women to be exercising. We don't want them to be afraid of exercising because of a lack of integrity in their core, because then they're going to reduce their risk for cardiovascular disease and cancer and osteoporosis. And so there's two different things, I think. I think, number one, challenging those societal beliefs about what you're supposed to look like is important, because I think at this point, the attainability for any woman to look like she's supposed to look like at any age is essentially impossible, because no one actually looks like the people that are on, magazine pages and stuff. Those people
don't look like that.
Yeah. I have a 12-year-old daughter, right? And so all 12-year-olds look like supermodels pretty much. They don't know it.
They think they look terrible.
But they really do. I mean, their skin is glowing. They look great. But there's no way, even at that age and that perfect kind of, youthful, vibrant body, to look right by any society standard. So at 40, you have to just be done with that, and not allow that to even permeate your skin, because it just doesn't exist. And I think now even more so than when we were teenagers. But I do think, as I said, that it's very important postpartum to take some time, and maybe not within the first 8 weeks, although, the sooner that you can start reconnecting to your core and pelvic floor in a loving way and a nourishing way helps, because tissues, if you kind of start to heal them more quickly after the surgery or birth or whatever, it's easier than if you wait a long time, because the collagen is just a little bit more elastic and things like that. Although really, there isn't an expiration date either. So I don't want you to feel like, you've missed the boat if you're 5 years postpartum or 25 years postpartum. There's still an opportunity for really excellent tissue healing. So immediately post-birth, simply just feeling really comfortable in your pelvis, in your abdomen, moving, realizing there are muscles there, moving them, reconnecting to them, noticing if your toileting positions are comfortable, noticing if you feel a lot of vaginal dryness, which you may, and that may be normal postpartum, because if you're nursing, your estrogen levels are going to remain low. Maybe you just need some coconut oil lubricant, really simple reconnecting to those tissues, giving those tissues some love and respect of the work that they've just done. And then working with a pelvic floor physical therapist to reconnect the coordination of the core and the pelvic floor, starting at about, realistically after that first 6-week appointment, making sure there's no infection, nothing sinister. But beyond that, taking whenever you feel ready. Scar mobilization, again, that's easier done closer to the scar occurring, to the incision occurring. So scar mobilization can be done at that early window of within the first 2 to 3 months, once the scar is fully healed. And then step by step being able to progress so that you can regain full strength in the pelvic floor. And it's not really about tightness for your partner, but it can be about sexual satisfaction. It can be about support for the bladder and the rectum so that you're not at risk for incontinence or prolapse. And all of these tissues do have the capacity to really fully recover. The other piece of the puzzle, there's 2 other pieces of the puzzle that I think are important. Number one, nutrition, so that you have the building blocks that those tissues need to recover. Collagen postpartum is really helpful, either collagen supplements or bone broth. And if you look in ancient cultures, a lot of women just were on broths for a while as a part of recovery postpartum. Lots of vegetables, blended soups, smoothies are great because they're easy. Also, you want to stay very hydrated, especially if you're nursing, because when you're rebuilding those soft tissues, you need a lot of vitamin C and other mineral and vitamin cofactors to be able to have those proteins really benefit the integrity of the tissue. So if your tissues are not so strong because your just nutrition is not very good, your hydration is not very good, it's going to be much more difficult to kind of rehab them back to, the new normal. When I work with postpartum women, and I also collaborate with pelvic floor PTs, they're always like, oh my gosh, her tissues are in such better shape. It's so much easier to do the work that we do because she's been, drinking bone broth all through her pregnancy and having, vitamins. And of course, that all depends too on the digestive function, because if she can drink all the bone broth in the world, but if she's got tons of dysbiosis and leaky gut, it's going to be hard for it to be absorbed. Although bone broth is actually in some sense a therapy for those things, so it can help. So nutrition, regaining of the strength, starting really gently, and knowing that it's important to rebuild that part of your body after birth. It's not a huge rush. You can do it over time, focus on your recovery, getting enough sleep, getting enough hydration, taking care of yourself and your baby. But that is a part of the body that we should give some attention to so that we can prolong our overall health well into our elderly years.
Well, I'm loving this conversation for several reasons. I love what you said for just a couple different reasons. And I think one of them is because after having gone through 2 births myself, what you said about just taking that time for your body to rebuild and heal, I think it takes the focus off of what your body looks like to kind of what you said about the integrity of your muscles. So going from this idea of looking a certain way to actually understanding what it's going to take for your muscles to rebuild and your tissues to recover. And that doesn't happen in 8 weeks, even if you look great. Even if you've done the Instagram hot mama thing and you put on a bathing suit or whatever, your muscles are still going to take that time to rebuild. So, as we kind of move towards the end of the interview, I do want to ask you a little bit about a few of the nutritional aspects. But to kind of close us out in what we've been talking about, I did want to ask you, just for the women who are listening, if there's a listener out there who's been doing your Kegels like religiously for the last 5 years, because of the way our world has told us to do that, do you have any kind of general suggestions or ideas for us that could help us to even stretch or relax or connect to our pelvic muscles, something all the listeners could kind of incorporate into their days?
Yeah, I think one of the simplest ways to do that is to sit on one of those exercise balls, because you can actually kind of rest your pelvic floor there and feel it sort of melt into the ball. It's cushioned, but it's kind of supported. So you're sitting upright in kind of 90-degree hip and knee angle with your sitting bones on the ball, and then just sort of relax your pelvic floor into the ball. And then while you're doing that, breathe deeply into the lower abdomen. As you inhale, kind of let your belly puff out. Oh, horrors. Right? So the belly puffs out, the pelvic floor kind of melts into the ball. And then as you exhale, that's when you can think about lifting the pelvic floor off the ball and kind of lifting up and in the lower abdomen as you exhale. And then again, so there should be a full range of motion there. And it's okay for the abdomen to move. It's okay for the pelvic floor to move. And just feeling that against the ball and against maybe your hands holding your lower abdomen. A lot of women don't take the time to really deeply breathe, and that makes a huge impact on our hormone system. But also it just allows a kind of expansion and contraction of the tissues of the core, giving us that neurologic coordination that we need postpartum to just get back into our pelvis, coordinate our pelvis from a brain perspective. So that's, I think, a really simple exercise that anyone can do to just reorient herself to her abdomen, her pelvic floor, and her breath as a place of kind of grounding.
Mm-hmm. Well, and that aligns with, of course, what you were talking about, kind of distinguishing that difference between tension and strength and tightness, because one of the things that I spoke about this on one of my podcasts quite some time ago, so I'll have to look up the number and I'll put the link in the show notes. But I did a podcast on sexual abuse and infertility and what the connections are and some of the particular struggles that a woman may have to face if she has experienced sexual abuse. And one of the things that we talked about, and the name is not on the top of my mind right now, but if a woman has experienced some sort of trauma, then having that tension where to the point sometimes where maybe her partner isn't able, if she's partnered and she has a male partner, isn't actually able to penetrate, which I hate that word, but isn't able because her vaginal opening is so tight. And I think it's interesting just to make that distinction between strength and tension. And you also alluded to the psychosocial components that could be at play. And so what I love about the exercise that you described is it encourages that relaxation piece of it as well as kind of that strength building piece of it. So
yeah, and so vaginismus is that when you have the vaginal muscles are so tense that it's hard to even have penetration. And that's one of those things that it's not an issue of weakness necessarily, but it could be. So doing more Kegels in that situation is not going to help at all. You have to address the feeling of safety. My other work now is in coaching, which, as I said, if there's trauma or past history of abuse that hasn't been addressed, that 100% needs to be worked on with a pelvic floor expert psychotherapist. But even women who have not experienced trauma and may not have sexual pain as severe as vaginismus to the point where they really can't even have penetration, but they may have pain with sex, or they may have to really, relax or drink wine, or, they've got to kind of go through a lot of hoops before they can have sex. A lot of times what I find with those women, if there's not a trauma history, there's not an abuse history, is that they simply don't feel safe in their bodies and in their lives. And so it stems back to all of these societal messages that only certain bodies are right, which are essentially none, no woman's body is correct. And, just how safe do we feel, when women become mothers, sometimes it's the first time that they stop working. So maybe they feel a little financially unsafe, even if they're in a good marriage. It's just not something they're used to yet. Or maybe they didn't have great parenting and they're fearful of their ability to parent. Or maybe they've had to move a lot for various reasons and they don't have a great support network. So it doesn't have to be to the level of significant trauma to be affecting our feelings of kind of safety and support that can show up in our bodies.
Mm-hmm. It's such an important point, I think, that we can always get really kind of lost in all of the kind of the physical components of it, because those seem to be easier to manage. If it's a physical injury, then let's, do this physiotherapy. And it's very like tab A meets tab B, quite straightforward. But when you're dealing with women who've had years and years of experiences, especially clients that are coming to you, I think it doesn't take long to realize that there's so much more at play that could be contributing to her experience of her pain when it comes, what it is, what it's associated with. So I'm really glad that you bring all of those things into play.
Well, and I actually do think, and I take the approach of body-mind medicine, I actually do think it's really helpful to address the more body pieces of the puzzle first. Is her diet nice and anti-inflammatory? Is she on all the supplements she needs to be on? Is she getting great sleep? How are her circadian rhythms? Is she got structural components that we can address, soft tissue things, strength? Because when a woman feels more vibrant and stronger and healthier in her body, is kind of clear out the brain fog, get her menstrual cycles back so that she's tuned into them. She's like got energy at certain times of the month. She gives herself permission to rest at certain times of the month. These really kind of physical components of general health. Once you do that, it's so much easier to address the more emotional, psychosocial components, because if you have to quit your job, or if you have to have a difficult conversation with your husband, or if you have to change the way you parent or the way you receive help, or, some of these bigger issues to really get to the root cause of your health problem, it's a lot easier to do that if you feel strong in your body and safe in your body. And so it's easier to say, okay, yep. I need to get a different kind of job, or I need to go to bed earlier. I need to exert, my opinion. I need to speak my opinion more commonly here. If you feel safe and strong in your body, it's just so much easier to have those kind of challenging psychosocial conversations and experiences, and even to plan those without getting really afraid or fearful of them.
Mm-hmm. Well, we've had such a great discussion today. If there was one thing that you would want our listeners to take from our conversation today, what would it be?
I would say that pelvic pain is a really quality of life altering condition. And so if you're experiencing pelvic pain and you haven't gotten the help that you need, continue to look, because there are really skilled people working in this area. But also know that your healing journey is kind of yours, and the people who help you by giving you information and tools and therapy recommendations are there to help you, and our goal is really to help you, but the journey is yours. So if at any point any of our recommendations don't gel right with you, keep looking. We work for you, and your healing ultimately comes from your own body. So we're here to just set up the environment to make it easier for your body to heal.
I love that. I think it's so important, and I always try to get that across, especially in my client work. You kind of have a team of people that are working towards you. Sometimes they don't always align with what they're recommending. And so it's really important for each individual woman to really connect and take time to sit with the recommendations and really figure out what resonates the most with her. So I love that. So I have a few questions then that I like to end the show with. So one of them is, what would you say is the biggest myth about fertility that you would like to see corrected?
I would say that, well, honestly, I think the biggest myth about fertility, I don't know if this is exactly a myth, but that we don't, from the beginning, look at both male and female fertility. If you're in a couple and you're struggling with infertility, about a third of the time there's a female physical related issue. About a third of the time there's a male physically related issue. And then the third of the time we don't really know. Whereas fertility seems to be kind of the job of the woman. It's really, your partner, your male partner, the male partner involved has to take the same level of kind of curiosity and commitment, because fertility is not a woman's issue. It's a human issue.
Yeah, absolutely. And last question of the day, for a woman who is currently on the pill, she knows she doesn't want to get pregnant right now, but she is thinking about pregnancy in the next 2 to 3 years. What advice, if any, would you give to her?
Okay. Well, the birth control pill is challenging, but the birth control pill is one anti-fertility, one birth control option. There are many others, and many of the others do help you better tune in to your own fertility, which allows you to both enhance your fertility or recognize when your fertility is increased so that you use other preventative measures to not get pregnant if you don't want to get pregnant. Having a 12-year-old daughter, there's no perfect birth control. I'm not going to be like, everyone should be on the, IUD or everyone should be doing XYZ, because it really is individual. But the birth control pill is not like the number one answer to every women's health question. So start to understand your fertility, because the more you understand about your fertility, the more you can have some autonomy over it and make really specific decisions for you about which kind of birth control method is more beneficial to you in that time.
Okay, well, thank you so much, Jessica, for being here today. It was so much fun talking with you. I'm really happy that we got to really dig into these topics, and I could have just kept talking to you for the for the rest of the afternoon and just picking your brain.
You too. I loved it. It was great.
Well, for our listeners, how can they find out more about you and the work that you do?
Our website is integrativewomenshealthinstitute.com. And we offer a lot of professional training for women's health and wellness professionals. And we have a virtual clinic. So we do work from a nutrition and coaching perspective with women from all over the world with fertility, pelvic pain issues, all kinds of women's health issues.
Okay, perfect. Well, thanks again, Jessica. It was so much fun talking with you.
Thanks, you too. Thanks for having me.
Thank you for listening. If you enjoyed today's show, please share it with a friend. You'll find the show notes page for today's episode at fertilityfriday.com/101. I really enjoyed my conversation with Jessica today. It was so great to be able to chat about some of the issues that arise after having babies and the societal expectations on women and our bodies and what our bodies are supposed to look like 2 weeks after we've given birth. And so I really like that Jessica brought it back to the actual health and structural integrity of our muscles and our tissues, and not just focused on what we're supposed to, quote unquote, look like after having babies. I also love the approach, which really illustrates that functional medicine perspective, where you're not just looking at one aspect of things and you're not just reducing it down to one component. I love that Jessica brought in all the different factors that could contribute to pelvic pain, whether it's an actual physical condition, whether it's a hormonal imbalance or a structural issue like a trauma or after birth or something like a car accident, but also inflammation, gut health, and all the different factors that can contribute to pelvic pain. And what I love about her approach is that she addresses the whole woman and really looks at everything that's happening and kind of establishing her health first and then kind of addressing anything else that arises. So I really appreciate Jessica's perspective, and I hope that you enjoyed today's episode. Before we end the show today, I'd like to take a moment to thank my sponsor. Today's episode is sponsored by Green Pasture Products. They offer fermented cod liver oil, concentrated butter oil, coconut oil, and a variety of products and blends. One of my favorite products that they offer is fermented cod liver oil, and it's one of the few food-based supplements that I always have in my house. And not only do I take it, but my kids take it too. The fermentation process preserves the natural vitamins A and D, which your body needs to make hormones. And in episode 9 of the podcast, I interview Sally Fallon-Morell, who is the founder of the Weston Price Foundation. And in that episode, she talks in detail about the benefits of vitamins A, D, and K. So make sure to go back and have a listen to that episode, and also head over to greenpasture.org for more information about the products. And if you've been enjoying the podcast, please look for it on iTunes and leave a 5-star review so that more people can find it. It really makes a difference. Also, if this is your first time listening, make sure to hit subscribe so that you'll be notified whenever a new episode is released. And make sure to head over to fertilityfriday.com and join my email list. If you have an idea for a podcast episode or a guest suggestion, do send me an email at info@fertilityfriday.com. I just want to thank you so much for hanging out with me today. I appreciate all of you for taking the time to tune into the podcast and let me be part of your day. And as always, until next time, be well and happy charting.